Today we're diving into one of the most overlooked yet most powerful parts of pregnancy preparation, your pelvic floor.
And it's just like this expectation that women are just, because we're like earth mothers, we're all just going to know how to squeeze our pelvic floor and do the exercise. It's just like ridiculous.
Yeah, it is still that like, oh, is it embarrassing to talk about the fact that my vagina is doing this? And it's like, well, you are a woman, therefore you do have a vagina and we've all got one. We've all seen them before. We can talk about them.
At the end of the day, I think we have phenomenal care. You know, we do look after women generally very well in pregnancy from a medical perspective, very much screening things, checking things and all that sort of stuff. But pelvic health is just not a part of that screening mechanism. Like, no woman's asked about constipation. No woman's asked about, do you have pain with intercourse?
And also, what I think is really sad, Claire, is then women will go, I just wish I'd done X, Y, Z.
What other muscle group in the body would you ever be like, just squeeze it? Like, you know, if it's basic, just keep squeezing. I mean, how unuseful would your arm be if all it could do was squeeze, right?
Hello, I'm Pip, and welcome to the Midwife Pip podcast, the home of expert information and real chats on all things pregnancy, birth, and beyond. Today, we're diving into one of the most overlooked yet most powerful parts of pregnancy preparation, your pelvic floor. It's a group of muscles that literally support us as women and play a huge role in how you birth, recover, and feel in your body afterwards. But for many women, it's a complete mystery until something goes wrong. Our guest today, Clare Bourne, is a renowned pelvic health physiotherapist, author, and educator who's helped thousands of women prepare their bodies and minds for birth with confidence, knowledge, and practical tools. So grab a cuppa with us as we unpack what really happens to your pelvic floor during pregnancy and birth, how you can prepare it for labour, and what recovery actually looks like beyond the myths and quick fixes. Welcome, Clare, and thank you so much for joining us as a repeat guest on the podcast.
Oh, well, thanks for having me back. Always a joy.
Always a joy. Clare and I could have talked for probably half a day before we hit record on the podcast, and then we suddenly realised we needed to save all the good stuff because it is such a topic that we're both immensely passionate about, but it's so misunderstood. Sometimes I feel like, Clare, it's a bit almost belittled or played down in terms of its importance until you meet someone that's really been impacted by a pelvic floor complication, and it kind of almost hits home as to how important it is that we get this right.
Oh, completely agree. And I think really it comes foundationally down to proper education as to what is that. I feel it's like a mystical thing, the pelvic floor, like it's just floating in the body somewhere and we don't really know where it is. We don't really want to get educated about it. It's just like, do it. And then it's just like this expectation that women are just, because we're like earth mothers, we're all just going to know how to squeeze our pelvic floor and do the exercise. It's just like ridiculous. Like, do you know what I mean? It's like, we have to educate people on their bodies. I mean, it goes back way before pregnancy. You know, we are not educating women full stop on their anatomy of the, you know, vulva, vagina. Like, I get a lot of women who in clinic are like embarrassed to admit, they're like, I don't really understand the holes. Like, I don't really understand, does the wee come out? You know, how is it different to the vagina? And I'm like, there is just no shame in that question because no one ever has clearly no one has ever sat you down and looked at an anatomical model. And even the anatomical models we see in like books are often totally wrong. I always laugh because it makes it look like your urethra is somewhere like in this village. Your vagina and your womb is somewhere else. And your bowel is way over there.
They're actually very close.
Very close together, all sitting on top of each other. I'm like, you remember like as a mum when you've got two young kids and they're like on your face? I'm like, that's much more what your anatomy is like. Okay?
I love that. So right.
Very up close and personal, all very connected all the time. So that's whether it's, you know, if we just don't get that bit, of course people aren't going to buy into why it's important and understand then the significance. So I think we just come in so late to the story when actually I'm often like, let's just go back a few steps, get this bit right. And then we can because then most women, I'm sure you feel the same. Once you tell them the why, they're like, right, I get it. I know what to do. I'll do the plan. But the people, we don't do it because we don't have that bit. And so then
it's like if someone says to you, you've got to eat your fruit and vegetables, but no one explains why. You're like, no thanks, I'll go for chocolate. You know, like, because where's the motivation?
Tastes probably better, you know? So I agree. I think context and understanding is so important, and we
Mm,
lack that in so much of our healthcare at the end of the day, and just in society, especially with this area of the body. And I think
mm,
we've come such a long way within understanding like bone health and muscle health and why it's important to exercise and heart health and all these other things. And I just think pelvic health needs to be as loud and as part of the conversation. But because
yeah,
it's still associated with like taboo related things or genitals, we're still
yeah.
a bit like, ooh, ooh, ooh.
Yeah, yeah, yeah. It is still that like, oh, is it embarrassing to talk about the fact that my vagina is doing this? And it's like, well, you are a woman, therefore you do have a vagina, and we've all
Right.
got one, and we've all seen them before. We
We've
can
all
talk
seen,
about them. And I
yeah.
think, like you were saying about education, Claire, and I think what's such a barrier is like women are like, well, even if I really wanted to understand my
Yeah.
pelvic health or my body as a female, where the hell am I going for this information? Like, who's meant to be giving it to me? Because it's just not
Yeah.
accessible. And I was speaking to you just before we hit record about I delivered a workshop about pelvic health to a big group of really experienced midwives just last week, and just did a quick show of hands so I could pitch kind of, what level of depth we were going into here about who had had some sort of professional training or conversation around pelvic health in pregnancy, and not a single hand in that room came up, which for me, we're not expecting, unless you are a pelvic health specialist, for you to be a specialist in pelvic health. But
No.
we do need to be in a place where we have a basic understanding, or we just know where to signpost women. We can identify a deviation from normality and
Yeah.
signpost women on. And one of the key things I often say is that, like, because there is still this taboo about saying my vagina is, or I am leaking urine, or I'm finding sex painful, we're still
Mm.
so worried about saying those things. We need almost the healthcare practitioners that are like, midwives are in such a powerful position because women are coming to them in pregnancy when typically they are starting to think about this thing, this mystical pelvic floor thing, for them to be able to initiate that conversation. So if
Yes.
women are a bit like scared to talk about sex or urine or vaginas, if someone else says how is, and uses those taboo words that women are a little bit anxious about, we can start normalizing these conversations. It's like
Totally.
that education we just need to get. I know you're doing phenomenal work with, your book that really allows women to start understanding their body. But it is such a barrier, isn't it? Like, it's basic empowerment just to understand the workings of ourselves.
Totally, totally. And I think, being a mother myself, so my kids are now 8 and 5. So I've, done this for a little while now. And it's been really fascinating to, I think, reflect and learn through that experience that, actually children are not born with shame. They're actually born
Mm,
with no shame. And shame comes through society and what we model to them.
yeah.
So, I mean, I'm medical, my husband's medical. So, obviously, we're a very medical household where there is a lot of conversation around anatomy and who we support and what we support. So, to them, it is incredibly normal. And it's fascinating to see how relaxed they are to say terms like vulva, penis, whatever it is, literally like we're chatting now. Is that there's
Yeah.
just no shame. And I think it's really woken me up to the fact that actually, my hope would be that generationally things will change. If we can become more comfortable as a generation who
Mm,
bring up the next generation, they will be much more comfortable and educated, then they can change it. And that's how change will really come. Obviously, we want more lateral change as well, like happening just all the time. But I do just think it's sometimes really hard to educate up the chain, is how I think of it.
yeah.
Like, I mean, I think it's so amazing you had the opportunity to talk to those midwives, and hopefully they'll all go away and reflect and think, wild.
Mm,
I didn't get educated. I mean, in my degree, and I've been a physio for 16 years now, there was an optional module in women's health, and I
mm.
did not opt in because I had no idea about it. I didn't know what
Yeah.
it was. So I've done all my learning postgraduate of
Mm,
everything that I know. Nowadays, in the undergraduate, there is pelvic health included, not necessarily everywhere, but there is much more coming through, which is wild to me that a physiotherapist who is a musculoskeletal specialist can come out of university not even knowing about one key muscle group in the body. But
yeah.
yet I knew everything about the brain and everything else. So many shifts need to occur, but I think it can
Mm.
happen on many, many levels. And I think that's the exciting thing about it, is that we are seeing that change, but we still have a lot more to do.
Yeah, definitely. And I think change, like, we can beat a drum as professionals, but
Yeah.
change is so much more powerful when it comes from service users, when it comes from women. So, if you are like, yeah, I have no idea what these women are talking about, but it sounds like it's probably relevant to me, like, ask those questions,
Yeah.
demand that service, that's where we see change happen so much more than us being like, we need to do this for people, but it's the people that are often that driving
Yes.
voice and actually seeing that happen so
Yeah.
often.
So true. So true.
I think often, Claire, when we hear the term pelvic floor, women think, oh yeah, squeezes, those Kegels, that like squeeze my
Kegels.
bum, squeeze my vagina. But actually, there is so much more to it, isn't there? What would you say was kind of the actual truth in preparing pelvic floor for birth? So everyone isn't just sat
Absolutely.
listening to us squeezing somewhere randomly in their
Yeah,
body.
somewhere.
It's their pelvic floor.
Hope for the best. I know, I find it so funny because I'm like, what other muscle group in the body would you ever be like, just squeeze it? Like,
Just
if
hold it
it's
there.
just keep squeezing. I mean, how unuseful would your arm be if all it could do was squeeze, right?
Yeah.
This comes back again to the education of the pelvic floor
Mm.
muscles are a group of skeletal muscles like biceps, like triceps, so they're in your conscious control. They are a muscle that can be strengthened, they can be exercised. If you don't understand that piece, the rest doesn't make no sense. And that's why
Yeah.
everyone's like, oh, maybe they're different. They just need squeezing. And it's
Mm.
like, no. So I always describe, and I talk about this in my book, a pelvic floor puzzle it's a baby puzzle. It's got 4 pieces: strength, flexibility, endurance, and coordination. And often the focus of the squeeze part is strength. It's like, oh, it's this assumption that we're all just so weak,
Yeah.
got no strength, and therefore we hit pregnancy and all we need to do is squeeze. Right. Some of us may not have great strength, but strength really comes, as you'll know because you love training, when you move the muscle through range repeatedly in a challenge way over time. Therefore, it is very hard to build strength if you don't have flexibility. And actually, what we are seeing with a lot of women is that they actually can't necessarily easily let go. So even in clinic on a weekly basis, I'm in clinic 3 days a week, and there are so many women who are like, I don't know how to let go because all I've been told is to hold, or
Yeah.
I've got prolapse symptoms. I therefore do not want to let go because I'm actually scared, or I'm scared to leak urine. So surely if I just hold, it will stop that. And I'm like, it doesn't make a functional, happy muscle just to hold it all the time. So this is where the dynamic of it is then really important. So we need to work on flexibility, which then might help with strength, which then we can build endurance. But then we also need it to do the right thing at the right time. For example, we're in birth, in a vaginal birth, the pelvic floor needs to release and let go. They need to be flexible to allow the baby through. Postpartum, they need to be re-strengthened. So though they've been through a lot, they can then keep you continent when you cough, sneeze, and laugh again. So already you can start to see far more complex than just do a few squeezes, which is why when we're like, I've done my Kegels and they don't work, I'm like, give me a chance. Give me a chance. Because I'm not surprised. I always say to people, I'm not expecting Kegels to work for you, to be totally honest with you. Also, pelvic health is way more than just what are your pelvic floor muscles doing. Therefore, if my job was just to make people squeeze, then it would be pretty boring. And I don't think I should need much training. Do you know what I mean?
Yeah, I love
So
that.
way more to it. Way more to
Yeah,
it.
and I think when we talk about like pelvic health being that whole body system, I
Yeah.
think generationally where we've really let women down is this. I think that connotation I hate of like hold your tummy in. People like, oh, hold your tummy in,
Yes.
like your tummy should be flat. And then we
Yeah.
see women, you can always look at somebody and you can see all that tension in their abdomen. You're like, your pelvic floor is on, on, on. We already know what the problem is before we even got there. And
Yeah.
that whole generation of understanding our body, understanding how we breathe and how that's connected to our pelvic floor has got so
Mhm.
lost that
Yeah.
Kegels aren't going to save us. Like until we strip it back and get that empowerment in our bodies, we
Totally.
like Kegels just aren't. They're not the thing that's going to fix us. Sadly, if only it was that easy.
I know, if only. If only. But I think it comes back to even like what I hear you talking about with birth prep, in the sense of like our mind, our body, what we think, how we feel, it's all connected, right? So you're right in the sense of pelvic health is full body. There's nothing more emotional and challenging than some of the symptoms that women experience regarding pelvic health. It's related to your sexual function, your relationships. It's so multifactorial, and it's constantly up, down with our nervous system and our brain. So it's full body. Unfortunately, our healthcare system, and I don't think at university, we already had any training on that concept, It's very much like, this is a body system, this is a body system, this is a body system, and
Yeah,
this is how they work.
yeah,
Rather than this kind of like, as you know, in labor, like if you're afraid and scared, adrenaline comes in,
yeah,
generally stalls labor. Well, that's not, that's a complex physiological process
yeah.
that's also emotionally and psychologically influenced. And I think my real passion is to help women understand that you are not cut up into many parts that don't communicate. You are one person made up of many parts that all communicate. And therefore, your
Mm,
pelvic floor will respond to emotions, to feelings, to thoughts, to questions, to concerns. And that has to be part of your story, which is why just doing a bit of squeezing doesn't cut the mustard, because it's
mm,
just not complex enough for quite a complex human, which we all are
yeah,
cellularly,
yeah.
physiologically.
That, and you talking about that with the squeezing and pelvic floor, it completely reminds me of the mirror of pelvic girdle pain and let's just stretch. Like, I'm doing all
Oh,
the stretches and it's not working. And when you look at the pelvis and how many nerves there are running straight through the middle of it, that's
yeah,
again like pelvic girdle pain, more and more common, and
more
has such a nervous system
yes.
trigger and response
Mhm.
into it. But the kind of solution that society wants to tell us is, if you're leaking urine, then squeeze your pelvic floor. And if you've got pelvic girdle pain, then stretch your hips. And
Yeah, yeah, yeah.
it's just a
So,
lie, isn't it?
yeah,
It's
I
just a
mean,
lie.
wild that I went to university for 3 years to learn that. I mean, you know what I mean? It just, we've oversimplified stuff so much, and it's hard, isn't it? Because you need a level of simplicity so that people can engage and understand. But I think that's our role as healthcare professionals, is really our job is to meet somebody, understand them, understand their body, understand their life, and then
Mm,
bring together a step-by-step approach that works for that individual.
yeah.
You know, I'm really passionate in talking about this biopsychosocial model of care that we much
Mhm.
more use, and is a growing kind of model research wise and everything else. So, you know, bio being biology, so that more like
Mhm.
physical side of ourselves, psychology obviously being the mind, and then social being your life. And
Mhm.
actually, kind of like, it's almost like a Venn diagram where they're all attached, and in the middle is you. And all of these things will feed into your life. And sometimes the biology will be louder, sometimes the psychology will be louder, but you literally cannot separate one bit from the other, because they communicate all the time. And I mean, you could apply that to birth, you could apply that to nearly every element of life. And that is something I think we need to get much more understood as a principle as well, and very much within pelvic health and pain and pelvic pain and a lot of pelvic health symptoms.
Mm, mm.
And actually, I think before we were always afraid of like, oh, we don't want someone to think it's all in their head. But actually, I'm like, to me, this proves it's not all in your head, but it's just saying that your head is part of the story, in
Yeah.
the same way that, like, I can't get through a day without my head being part of the story, because it's part of like how I
Yeah.
make my decisions, how I remember to go places. Like, I can't cut my head off, the rest doesn't work.
Yeah.
So it's that sort of understanding, which I think can
Mm.
sound quite complex, but when you break it down, most people are like, right, that makes total
That makes
sense.
sense. Yeah, and I think it's understanding, isn't it? It's not fobbing people off and saying like, as a
No,
pelvic health physio, that's not my problem. It's in your head. Actually, it is your problem,
my
and
problem.
this is why we're getting the responses that we are, and that's part of that kind of fine tuning and part of your treatment pathway.
Yeah.
Essentially, it's being honest with people. Like we've almost become afraid to be honest
Yeah.
with people.
Yeah.
But it's so important we are. And another thing that I think is really important that we're honest about, Claire, is the fact that pregnancy will cause some sort of injury to our pelvic health, to our pelvic floor, to our abdominal wall. And there's often this fear that, okay, whatever happens during birth, particularly a vaginal birth, that's
Mm,
where the damage happens. But
yes.
actually, we know that just by going through a pregnancy, women
Mhm.
have an injury to their pelvic floor that needs some support and rehab. I feel like that's something that we don't vocalize enough. It's kind of a real focus on the birth causing a problem.
Yeah. Oh, totally. I always talk about, I mean, and also the person you were before you became pregnant. You know what I
Yeah.
mean? I was like, pelvic health doesn't start a pregnancy.
Yeah.
You know, we treat children with pelvic floor problems.
Mm,
So, you know, we have to, and this is really why I wrote my book, Strong Foundations, because it goes from childhood to menopause, to really
mm,
actually destigmatize the pressure that women feel like it was my birth that ruined everything.
yeah.
Look, it might have been an absolute contributing factor. But also, if you're birthing at 35, there's an awful lot of your life before that point that also plays in. You know, people with IBS have constipation, maybe have always gone for a wee more frequently, more urgently. have always found smear tests painful, have always struggled with tampons. There is always
Yeah.
more to a story because we don't just wake up at pregnancy and suddenly have a pelvic floor.
Yeah.
That's been there the whole time. So I think that's what's so important. Yes, absolutely. Pregnancy alone is a massive experience for the body. I mean, physiologically, look what's going on.
Yeah.
There is a stretch to the abdomen, there is a stretch to the pelvic floor. Now again, the reason it's so important to talk about this topic is because we can actually do a lot of prevention
Mm.
of issues, and actually there is a lot of really supportive research to back that up, that being preventative in pregnancy, the reason we bang on about it and everyone's like, yes, 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 is because it's backed up that women who do pelvic floor exercises regularly, I mean, first of all, they need to know what that means, how to do it correctly so
Yeah.
they can actually do it. But if you are doing it regularly, it can prevent incontinence, and a lot of focus is often on incontinence at the end of pregnancy and
Mm-hmm.
postpartum. So amazing, right? I mean, brilliant. We could be preventative. So yes, it's acknowledging what's going on, not being afraid, and then being
Yeah.
empowered to be like, well, what can I do as much as I can? And if I'm honest, clinically, because I work privately, I obviously have the absolute privilege of anyone can come in whenever they want. There isn't a
Yeah.
sort of like criteria. I'm
Yeah.
seeing a lot more women coming in being like, I want to be proactive. I
Yes.
want to be preventative. And that's amazing. And honestly, we see amazing results with that
Yeah.
support. And what I want people to hear is that doesn't mean coming to see someone like me on a weekly basis for your entire pregnancy. The majority of people I see twice. I see twice. That's it.
Mm.
And then they go off and they do the work. You know what I mean? But it's
Yeah.
just, you need to understand what and why and then do it. But yes, birth can get all the blame, but we are one story,
Yeah.
and a lot
Yeah.
comes before that.
Yeah, I love that. And I like the idea that actually, when you understand your body, you can then be empowered to proactively do things to help
Yes.
mitigate some of those concerns,
Yeah.
some of those injuries, and just to protect yourself long term. Because sadly, so many pelvic floor injuries that we see, like you'll be the same kind of clinic. You're like, oh, if we just done X, Y,
I
Z, if you just known, and women will say, I just wish I knew, like I just didn't know that it was
know.
important. And we all know that we should like brush our teeth twice a day so that we
I
don't have to
know.
go and have loads of dental work. It's literally the same. Protect your pelvic floor so that you don't need XYZ later on, so that you're not on a surgical waiting list, so that you hopefully don't need lots of,
Yeah.
intervention. It is that always protection's better than cure. But I feel
Yeah.
like we're still really behind in that with pelvic floor. Maybe because you don't see it, because it impacts us, but no one else can
Yeah.
actually really see that. Maybe that's why we kind of just deal with it in secrecy, or
Yes.
it doesn't get up that priority list so much.
I also just don't think our healthcare system is set up for prevention because we don't have the funding for that. And
Yeah, like, yeah, where are women go? Like you say, like, yes, there's really broad now, wide private services that women can usually access somewhere local to them. But unless they've got a real problem, getting that care on the NHS, getting that education on the
really
NHS
hard.
is really hard. It doesn't
Yeah.
exist, to be
No.
honest. This episode is sponsored by Biogaia, designed to support tiny digestive systems and bring comfort when it's needed the most. Just a few drops a day can help maintain balance in your baby's gut, supporting everything from uncomfortable symptoms to overall well-being. Trusted by parents worldwide, Biogaia probiotics are gentle, safe, and backed by science, giving you peace of mind and hopefully a little more rest too. You can find Biogaia baby probiotics at biogaia.co.uk, because when your baby feels better, the whole family does too.
Yeah, I mean, as a prevention part, definitely not. I think there are amazing services providing brilliant care for problems, because
Yeah.
it's very hard to fund prevention for the entire population.
Mm.
And when it's funded essentially through taxes, it's different to other countries where it might be 50-50, or people do have to invest in their health. And
Yeah.
I think it's also very hard for us as a country when we've got the NHS, which, gosh, we were talking about before, is phenomenal. But when that's your model of that's gold standard, you don't actually expect there to be a need for anything else, because you think, oh, that everything else is then a luxury.
Yeah.
What I often say to women is that like education and support and preventive care is not actually a luxury. Unfortunately, in my opinion, it should be something that is available for everybody, because I
Yeah.
think look, I'd love to be able to prove long-term data that if we caught more women early on with more support, could we prevent more surgeries, which ultimately financially would cost
Yeah.
a lot more.
Absolutely. And we know that would happen, but it's never going to be a business
Doing
case
a
for the
30-year
NHS right
research study and
now.
capturing that, it will always be really challenging. But I think what I want women to know is just because it's not modeled within our current care system, which is brilliant, I will not be rude about it, but it doesn't have everything I think women deserve,
Yeah.
doesn't mean it's therefore like a luxury. And I think that's what such a mindset of, it's like, you know,
Mm.
understanding your pelvic floor is not the same as like a haircut and getting your nails done or whatever other luxury spa day. For me,
Yeah.
this is like a foundational part of being a human that we all
Yeah.
deserve. So it's a really, it's a mind shift, if anything, to
Mm.
help us all understand that better. And I've had to go on that journey myself. Do you know what I
Yeah.
mean? Like we all have to. But you know, often women who do choose to invest a little bit if they can are like, I'm so glad I did, and I can see the benefits in myself. And in the same way with the
Mm.
work that you do, you know, I know that support in pregnancy to prepare mindset, thoughts, views for birth is so important.
Mm.
And it's all the same model. Does that make sense? So it
Yeah.
might be applied to something that looks different, but really it's empowerment, education, decision making, understanding you better. And if we can do that best, then amazing, everything else
Mm.
is much easier.
Definitely. And I think the powerful thing about that short term, energy, time, financial investment in your pelvic health now, you then
Mm,
have that forever. Like you then
right.
understand your body as a female through all your life cycles forever.
Really?
And you pass that down to your children. Like it
Yeah.
is a really powerful thing. And it's a really great baby shower gift. Like you do
Yes.
not need thousands of hats or
No,
grey baby grows. Like you absolutely don't. But
that's obvious.
actually an appointment with a pelvic health specialist where you can actually ask those questions, be empowered,
Mm,
understand your
mm,
body will impact you like forever. It's
yeah.
lifelong.
Yeah, absolutely. I just always say that, you know, you're never, even if you have setbacks and symptoms, you're never the same person as you were before. You know what I mean? And that
Mm.
can be a hard journey to navigate. But actually, you know, what I learned through my first birth helped me with my second birth. What helped me,
Yeah.
my rehab experience after my first child helped me with my second. And you're always learning. And though it often feels, you might be like, oh, I'm not who I was back then, I've gone way backwards or whatever it might be. I'm like, you're always actually moving forwards.
Yeah.
You're just always learning, but just things look different. And navigating that can be really hard mentally and emotionally,
Mm.
for sure. Which is why I think, you know, you need that support. You need a clinician to support you with that. But yeah, you never unlearn empowerment in your body. You might just feel a bit disconnected from it for a while, but you never lose that, which is amazing.
Mm. Yeah, that's yours then to keep, isn't it? Forever.
Totally,
When
totally. And it's
you
your
is
body.
Yeah, it is. It's your body, and we deserve that. We deserve that empowerment. Like we're literally
Mm,
growing a human life. Like our
no,
bodies need to know how
amazing,
to be protected through that. Is there
amazing.
anything that you see, Claire, or hear as a pelvic health physio? Is there anything that you really want to try the women that you
Mm,
see or care for to avoid, to try and reduce kind of pelvic health injury? So like for
mm.
example, in pregnancy, I'm always like, constipation isn't just this normal symptom we should ignore. Like it's one of our leading preventable causes of prolapse, like, and we can address it really quite simply. Really,
Yes.
really important. Are there any things that like you see that you're like, okay, these things we really want to try, it's not always possible, but we want to really try and avoid or mitigate?
Yeah. I mean, you're absolutely right. Bowels, I think everything starts with bowels, and often we're still just so embarrassed to talk about it. And
Yeah.
I will always ask about it in pregnancy, like, oh, you know, it's okay. And I'm like, right, what's happening on a day to
Yeah.
day basis? And they're like,
Yeah.
well, I'm going over like 4 days. I'm like, no, 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 no.
Yeah.
Let's try and sort that out for you. But I think women are nervous to take laxatives or nervous to take things to help,
Yeah.
and that can be really tricky. But yeah, I'm always a big promoter of like
Mm.
improving bowel health, 100%. I think if I'm really honest, I think what I really wish women understood was physiologically what's going on with the pelvic floor during vaginal birth.
Yep. Hmm.
Because I think so many people still think that their pelvic floor pushes the baby out. And I'm
Yeah.
like, no, 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 no.
Yeah.
The pelvic floor needs to
Get
get the
in the
hell out
way.
of the way.
Yeah.
They don't really want to be involved apart from
Yeah.
just chilling the frick out.
Yeah.
And so I think that education piece on like that visualization of letting go, real
Mm.
visualization, I guess it's more birth related than pregnancy. But yeah, I think if we could, I often explain like pulling on a jumper,
Yeah.
the pelvic floor needs to release gradually around the head. That can help prevent,
Mm.
overstretch, significant stretch suddenly. Um, at the end of the day, if you don't know how that works, it's very hard to then implement any strategic stuff
Yeah.
into actually when you are birthing.
Yeah.
Um, so I think for me, those would be the two big things. If we could get those two
Mm.
things better, obviously coming back to what we said right at the beginning of understanding your pelvic floor, understanding the complex of the pelvic floor puzzle, and actually implementing that'd be
Yeah.
wonderful. But yeah, as a
Yeah.
prevention piece, I think knowing those two things can make such a big difference.
Yeah, you're so right. It's that understanding of your body, isn't it? And one of the things that, again, it comes down to understanding and physiology, I suppose. But one of my things is malpositioned babies, because we often are worried about malpositioned babies for lots of other reasons. But actually, they are often the thing that leads to interventions that we know are more traumatic to pelvic floor. You know, those
Yeah.
really long pushing stages, those
Yes.
instrumental births, those things that we know cause more stretch and more trauma to the pelvic floor are the
Absolutely.
reason is often a
Yeah.
malpositioned baby. And that is something that for a
Yeah.
lot of women, we can do something about.
Yes.
But it's
True.
so much harder to do it at the point of, well, we've already been pushing for this amount of time, or we've just identified it in the final stages of labor. It's so much easier if
Yeah.
that work's done in pregnancy before labor even starts. But again, it comes down to women understanding their bodies and understanding the
Yes.
physiology and
Yeah.
preparing for birth like
Yeah.
it is the big event that it is, rather
Yeah.
than this one day and we'll just sort of rock up and kind of
Hope
hope
for
for
the
the best.
best. Yeah, yeah, totally. Absolutely. You know, for me, it's really like, I mean, I've never run an actual marathon, I've done half marathons, but if I just rocked up that day for a half marathon and just hoped for the best, I mean, it would have been messy
Yeah.
and I probably would have ended up in an ambulance. You know, so it's really like that, you know, and I always say to women, that doesn't mean you need to be the fittest person on the planet. It doesn't mean that you need to be
Mm.
understanding as a basic level, which I find so sad that we just don't do that. And I just don't really understand where that's gone so wrong, because
Mm.
at the end of the day, I think we have phenomenal care. You know, we do look after women generally very well in pregnancy from a medical perspective, very much screening things, checking things, and all that sort of stuff. But pelvic health is just not a part of that screening mechanism. Like, no woman's asked about constipation. No woman's asked about, do you have pain with intercourse? It's just not a conversation.
No.
And I just think, gosh, if we could even screen, you
Yeah.
know,
Yeah.
of course diabetes, of course high blood pressure, of course those. So, and I think this comes down to like, how severe is it?
Yeah.
And that's a really subjective thing. Obviously, we're not often with pelvic floor talking life and death, which is why I think it gets deprioritized.
Yes.
And I think for a lot of women, I always say, when we benchmark on death, it is very much that everything else will fail,
Mm.
right?
Mm.
So if all that we care about is death or not death, which of course we all is our
Yeah.
absolute priority, because that's the only thing we allow ourselves to focus on, we really dismiss so much of
Yeah.
a woman's
So much.
experience.
Yeah.
So of course medical management priority, but this for me is such a priority as probably a second tier,
Mm.
because actually when I think you speak to most women as a longevity piece or a quality of life piece going forward, it's
Mm.
actually the physical changes to their abdomen and their pelvic floor
Yeah.
that are some of the biggest, or pelvis from a pain perspective, that really impact them the longest. And I would say that is the majority of birthing women,
Yeah.
to some extent.
100%. And like we talk about, like, I know it's that extreme of life and death, but actually then you see a woman that has suffered a prolapse and can no longer run, and it breaks down her relationship and she decides she's not going to have any more children, and it
Yes.
stops her engaging with social things, and she's got postnatal depression. Actually,
Yeah.
that's a real reality for women, and that for a lot of people was preventable
Yeah,
if we
yeah,
had
yeah.
done that work beforehand. Like
Yeah.
it does come down to that.
Yeah, absolutely. I mean, it's so hard with prolapse, isn't it? Because I was, and talk about this in the book, there were so many contributing
So
factors:
many.
genetics, story before, childhood habits,
Yeah.
lifestyle, constipation. Partly that's genetics, partly that's lifestyle, partly
Yeah.
that's psychology, partly, you start being like, well, you keep pulling the thread, being like, well, where does this begin?
Yeah.
And it's
Yeah.
impossible to. And obviously, yes, if you're also then pushing for 2 hours and had a forceps and all these
Mm.
things contribute, it can all start to make sense. But you're absolutely right. And the impact, it's impossible to say, could we have prevented it?
Yeah.
Could we have prevented it all? Who knows?
Who knows?
But as you said, and I think this was earlier, most women are traumatized because they didn't even know it was a thing.
Yeah. So they hear this, like, it almost feels like a death sentence, doesn't it? When someone says
Yeah,
you've
it
got
does.
this, and they don't know what that is. And also what I think is really sad, Claire, is then women will go, I just wish I'd done X, Y, Z. But
Yeah,
even if
big
they
time.
had the exact, and I often talk about this with birth, like you could have two people that have the exact same
Yeah,
birth, but the
what's
way
that?
they've been empowered and informed and navigated that changes it. And actually, if you have two women with a prolapse, but one
Yeah,
completely understood the risks of pregnancy and
yeah,
birth, they'd done all that, like, preventative work, they'd felt really proactive, then
yeah,
it is kind of almost at peace with there was nothing I could have done. There's no feelings of like almost regret that you hadn't done X, Y, Z, or
Totally.
you hadn't done these things. Whereas
Yeah,
that can be a really hard thing to live with even on its own, aside from injury.
totally. And I think even like just that kind of acknowledgement of like I did everything I could have done.
Yeah.
I would say, you know, when you even with like perineal massage, yeah, okay, the evidence may not be the best thing in the world, but if you've done something in your control, so much
Mm,
of birth feels out of control. And I would
yeah.
say to women, like, you actually have more control than you think, and that comes back to you doing as much as you physically can.
Yeah.
Um, and for me, you know, I mean, I've shared my own journey publicly. I talk about it in my
Mm,
book. Like after I had my daughter, I was diagnosed with a prolapse, which obviously in my world was like the worst thing I ever thought I'd ever get diagnosed with. Right? You're just
mm,
like, that's not part of the CV. I'm meant
yeah.
to be preventing
Yeah.
this shit.
Yeah.
And I think for me, like what was really empowering in my second pregnancy was going back through the story as to why that may have occurred. Like
Mm,
I had a long second stage. I think that was a huge contributing factor. Now, again, I had a long story before that, and I'd had some IBS and I had some bowel stuff that had also been going on. So it all contributed to, I think,
yeah.
this final presentation for me. I generally live day to day now completely fine. And it's
Yeah.
why I'm really passionate to talk about this stuff, because I think there is life after diagnosis, there is pregnancy after diagnosis, and there is so much we can do to support you to live a good quality of life with your kids, feel empowered, exercise, lift weights,
Mm,
whatever you want to do. But I think for me, the understanding of why birth had gone the way it did, or why that happened, and then for what I could do to change maybe some of those elements was
mm,
really empowering for me. And so I
yeah.
always say to women, it's like sometimes it's the unpacking that allows the process and the healing,
Mm,
which doesn't mean that the diagnosis will change. Does that make sense? It doesn't mean
yeah.
that we will say to you, you no longer have a prolapse. But it's
Yeah.
amazing how things can feel very, very different just through the understanding of the why and the
Mm.
contributing factors.
Yeah, and again, I think when women understand what that actually is, what that injury actually is in their body, rather than
Right.
this term prolapse, and they maybe go to Google and see these horrific images, actually when they
Oh,
understand it, it's
don't.
less scary. And they understand there is a process and support to move forwards rather than like, this is just it now. Like, this is
Yes,
what I'm left with. When we like just need to
totally.
unpack it, don't we? Support information. Like, I think we probably said that about 1,000 times.
But that it is what it comes down to. And I think, but what I think is so lovely about that is that that's actually easy to get.
Mm.
Nowadays, we have
Yeah.
way more affordable education. Like I've written a book, you've written a book, loads of people
Yeah.
have written amazing books that are like 14 quid, maybe 12 quid on
Yeah.
Amazon, that you can now pick up and read for yourself to educate yourself. You don't need to rely on a 100 and whatever consultation if you
Yeah.
can't, you know.
Yeah.
And for some people that's accessible and that's important, for others it's not. But
Mhm.
actually the baseline of what we all believe everyone should, I think is actually very affordable.
Mhm.
And of course we can scale on top of that as
Yeah.
needed.
Yeah, absolutely, absolutely. And just knowing where those people are, if you do need as well, can take some of that
Needed.
guesswork out of it. Last thing I feel like we just have to touch on is realistic recovery, because
Oh,
we are still seeing bounce
yeah.
back. We are still seeing influencers running at 6 weeks postpartum. We are
Yeah.
still feeling the pressure to be XYZ back in your jeans at this baby group, at
Right.
that baby group, back to whatever.
Yeah.
Oh my gosh, Claire, what is a realistic timeline other than not
Yeah.
6 weeks?
Absolutely. Oh, gosh, I mean, it is a wild, isn't it? And I think again,
Mm.
women just are like, "What? I thought I was told 6 weeks and that's it."
Yeah,
And I'm
couch to 5K at 6 weeks. Let's go. No.
like, "Oh, just can't think of anything worse." To be honest, I could think I could barely string a sentence together at 6 weeks postpartum. I did think I'd magically feel better, and I woke up that day being like, "Don't feel any
Oh,
better."
well, this is it. I'm
Yeah,
the same as I was 12 hours ago. Shocked.
yeah, exactly. Damn it. Look, I think again, I always come back to physiology, because at the end of the day, that's what we have, which is factual.
Mm,
And everyone's story will be different, you know. And I've treated thousands of women now, and I have treated like elite athletes down to just average mum like me who enjoys a bit of exercise, or even average mum who does not enjoy exercise and all she wants to do is go for a walk around the park. Now,
mhm.
we're not made the same necessarily, and we're
Yep.
not physically coming into pregnancy the same. So of course our stories will be different. And no, I've never heard any birth story that's the same.
No,
So
there is
there are
no one size fits all, was there
no
ever?
one says
Any
it's
of it?
all. But I think if you just look at understanding, so however we birth a child, abdominally, vaginally, there is impact to soft tissues. And soft tissues, so muscles, skin, fascia, if they are repaired, they take a minimum of 6 to 8 weeks to do an acute healing cycle.
Mhm.
So that goes from wound to like healed, formed wound that isn't going to open and is totally fine. So that's the baseline. So that's 6 to 8 weeks. So that's where this 6 to 8 week chat comes from, because it's like you've done the acute healing. Now, if you've had an injury to a muscle, which the majority of perineal tears will include, now a cesarean birth, they're impacting your muscles, but they're not cutting your muscles. So it's like it's a different sort of injury, but obviously many layers have been. So the healing process is often is different and longer in some regards. I never ever put vaginal recovery on a pedestal compared to C-section, because they're literally just everyone's different.
Yeah, there's so many thousands of variables to each of those.
Exactly. So I always just say birth recovery.
Yeah.
After that, we will have, whether you have no injury anywhere, you're still going to have muscles that need rehabilitating, because they've either been stretched in pregnancy, stretched in birth, stretched through your abdomen, that we need some rehab. So I think most of us understand, if you tore a muscle or you cut a muscle, that if that was your hamstring, you would do some rehab to re-strengthen before you reintroduce, right?
You wouldn't go running at 6 weeks post hamstring surgery, would you?
Absolutely. But also imagine the physiotherapy protocol that you would have to follow, because your surgeon would tell you to, right?
Yeah. You wouldn't just get a leaflet and wave on your way with sleep deprivation and a baby to care for and hormones all over the top.
I mean, within orthopedics, it's so interesting when you do a physiotherapy job in orthopedics, because there's so much protocol and there's so much, like, you're almost told how to do the job and what to do. And when it comes to like pelvic health, it's like, we're just going to cut that muscle, stitch it up, and just say, do whatever, 6 weeks.
Yeah, like wild.
But it does start to just show, like, when you just understand it physiologically, most women are like, sure, I get it. I don't think I do want to run, when I understand the why. So then 6 to 8 weeks on from that, muscles take generally around 6 to 8 weeks to start strengthening, if we're consistent in looking after them. So you might start doing the pelvic floor more religiously. You might return to some Pilates or a postnatal plan or something like that. That's going to take around 6 to 8 weeks. You don't go to the gym for a week and have a body transformation, as much as I wish I did. If only. So, muscles will take time to change. So it might be around the 12-week mark, maybe even between 3 and 6 months, that you suddenly start to feel like, oh, I'm feeling a bit stronger. I'm ready to lift heavier weights, go for a run. Now, that doesn't mean I don't think impact or lifting some weights can be part of a rehab journey, because that's how we work as physios. It's gradual, graded muscle change. But it's not a black and white, like one day you're not ready, next day you're ready. It's got to be viewed as like any other rehab program. And I think if we could just visualize that more and understand that more women would do it, because they get it. They're like, yeah, that makes logical sense.
Yeah, absolutely. And like rushing it does just set you back in the long term so often. Like it's not getting you where you really want to be, but actually, and again, if you understood your body in pregnancy, then that postnatal recovery would be easier, because you would have done some work to make that smoother, and you would have an understanding about how you could start that in a really productive way. So then those time frames, if you are someone that's in a rush because you psychologically really want that, or maybe it's your job or whatever, actually you put yourself in a place where those time frames feel more aligned to what your brain wants, and your vagina's got a bit of time to kind of catch up.
Yes, along with the journey. Totally.
Oh, Claire, I feel like we could talk all day about this. We definitely need a part 2. But if you could leave us with 3 top tips, what would it be?
Really read and understand about your pelvic floor before you start trying to do anything about it. Be preventative, have a preventative mindset, and just have no shame if you're struggling to talk about some of these topics, because we want to talk to you about them.
I love that. Absolutely. Like, they are, for us, it is dinner table conversation. There is no thing that's embarrassing, no overshare. Promise, whatever your thing is that you want to talk about, we've heard it 1,000 times.
Literally.
It's not something that's going to shock us. I think we're probably unshockable at this stage.
I'm totally unshockable. I think people are like, why did you not flinch? I'm like, oh, because
that's what we see all the time. Yeah, you're not alone. You're not alone.
They're like, oh, right. And I'm like, yeah, isn't that amazing? Like, we're all in this together.
Yeah. Oh, Claire, thank you so much. And if you are listening and you're like, I need to hear more of Claire's wisdom, experience, then have a look in the episode description, where you'll find both her Instagram page and her book linked as well. Thank you so much, Claire. I'll speak to you soon.
Speak soon.
If you have listened to this birth story, enjoyed it, and feel that you are ready to really embrace and dedicate yourself to having the most informed, supported, and empowered journey, and want to see if we may be able to support you in YPJ, your pregnancy and postnatal journey, please drop me a Instagram DM at midwife_pip or get in touch on my email, pip@midwifepip.com, and let's chat through things and see if we might be a good match for each other. I hope you've enjoyed listening and wishing you all the best on your journey through pregnancy, birth, and beyond.